Hello everyone. Let us practice questions and answers for the GPAT exam. What is pharmacokinetics? Pharmacokinetics is the study of absorption, distribution, metabolism, and excretion of drugs. In simpler terms, it describes what the body does to a drug. This includes how the drug enters the bloodstream, how it moves through different tissues, how it is chemically transformed, and finally how it is eliminated from the body. Remember, pharmacokinetics is essentially summarized by the acronym ADME: absorption, distribution, metabolism, and excretion. What does pharmacokinetics include with respect to drug metabolism? Biotransformation. Drug biotransformation, also known as metabolism, is an essential part of pharmacokinetics. It refers to the chemical modification of drugs within the body, primarily in the liver. Metabolism is classified into phase 1 reactions, such as oxidation, reduction, or hydrolysis, often mediated by cytochrome P450 enzymes, and phase 2 reactions, which involve conjugation to increase water solubility. This process ensures that lipophilic drugs are converted into more hydrophilic metabolites, facilitating their elimination from the body. What does pharmacokinetics include regarding drug distribution? Distribution. Distribution of drugs refers to the reversible movement of drugs from the bloodstream into various tissues. This process depends on factors such as blood flow to tissues, plasma protein binding, lipid solubility, tissue affinity, and the permeability of cell membranes. Only the free or unbound portion of the drug is pharmacologically active. Highly lipophilic drugs tend to distribute extensively into body tissues. What does pharmacokinetics include regarding elimination of drugs? Excretion. Excretion is the removal of drugs and their metabolites from the body. The primary route is via the kidneys into urine, but drugs can also be eliminated through bile, lungs, sweat, saliva, and even breast milk. Renal excretion depends on glomerular filtration, tubular secretion, and tubular reabsorption. Hydrophilic drugs are generally excreted more easily through the kidneys. What is the main mechanism of absorption of most drugs in the GI tract? Passive diffusion, lipid diffusion. Most drugs are absorbed in the gastrointestinal tract by passive diffusion, also called lipid diffusion. This process does not require energy and occurs down the concentration gradient. Drugs must be non-ionized and lipid-soluble to cross the cell membranes efficiently. According to the Henderson-Hasselbalch principle, only the non-ionized form of a drug readily diffuses through membranes. What kind of substances cannot permeate membranes by passive diffusion? Hydrophilic substances. Hydrophilic substances cannot permeate membranes efficiently by passive diffusion because they are water-soluble and do not dissolve in lipid membranes. Polar, ionized, or large molecules have poor passive diffusion and often require special transport mechanisms to cross cell membranes. What is a key property of a hydrophilic medicinal agent? Low ability to penetrate through cell membrane lipids. A hydrophilic medicinal agent has low ability to penetrate through cell membrane lipids. Such drugs remain mostly in extracellular fluids and generally exhibit lower oral absorption and faster renal elimination. Hydrophilic drugs may require active transport or channels to enter cells. What is implied by active transport? Transport against concentration gradient. Active transport is the movement of substances against their concentration gradient, from areas of low concentration to high concentration. This process requires energy, usually in the form of ATP, and uses specific carrier proteins. It is saturable and can be competitively inhibited. Many drugs are actively transported in the renal tubules for elimination. What does the term bioavailability mean? Bioavailability refers to the fraction of an unchanged drug that reaches the systemic circulation following any route of administration. For intravenous drugs, bioavailability is 100% because the drug directly enters the bloodstream. For orally administered drugs, bioavailability may be reduced due to incomplete absorption or metabolism in the liver before reaching systemic circulation. What determines bioavailability? Extent of absorption and hepatic first-pass effect. The bioavailability of a drug depends primarily on two factors: the extent of absorption from the gastrointestinal tract and the hepatic first-pass effect. After oral administration, absorbed drugs pass through the portal vein into the liver, where they may be metabolized, reducing the amount that reaches systemic circulation. Drugs with high first-pass metabolism will therefore have low oral bioavailability. Which alimentary route minimizes passage of drugs through the liver? Rectal route. The rectal route of administration is used when we want to minimize the passage of drugs through the liver. Drugs administered into the lower rectum partially bypass hepatic first-pass metabolism and enter systemic circulation directly. This route is particularly useful for patients who are vomiting, have difficulty swallowing, or when the drug is extensively metabolized in the liver. Note that the upper rectum still drains into the portal circulation, so only partial bypass occurs. Which route of drug administration is most likely to lead to the first pass effect? Oral route. The oral route of drug administration is most likely to lead to the first pass effect. This occurs when a drug is absorbed from the gastrointestinal tract and passes through the liver via the portal vein before reaching systemic circulation. In the liver, a significant portion of the drug can be metabolized, reducing the amount available in the bloodstream. Alternative routes such as sublingual, rectal, intravenous, or inhalation largely bypass the liver initially, minimizing first-pass metabolism. What is characteristic of the oral route of drug administration? Absorption depends on gastrointestinal tract secretion and motor function. A key characteristic of the oral route is that drug absorption depends on gastrointestinal tract secretions and motor function. Factors like gastric pH, gastric emptying rate, intestinal motility, and digestive enzymes influence how quickly and completely a drug is absorbed. This makes oral administration convenient but variable in its effects. What is a key feature of the sublingual route? The sublingual route provides pretty fast absorption. Placing the drug under the tongue allows it to enter the highly vascularized mucosa, bypassing the hepatic first-pass metabolism. Sublingual administration is useful for drugs requiring rapid onset, such as nitroglycerin, and is generally suitable for small, lipophilic, and potent medications. Pick out a parenteral route of medicinal agent administration. Inhalation. Inhalation is considered a parenteral route of administration because it bypasses the gastrointestinal tract. Other parenteral routes include intravenous, intramuscular, and subcutaneous administration. Parenteral routes allow rapid drug absorption and onset of action compared to oral or rectal administration. What is true about parenteral administration? Parenteral administration usually produces a more rapid response than oral administration. By delivering drugs directly into systemic circulation or tissues, parenteral routes avoid the delays and first-pass metabolism associated with the gastrointestinal tract, making them ideal for emergencies or when oral absorption is inadequate. What is characteristic of intramuscular, IM, drug administration? Oily solutions can be injected. The intramuscular route allows the injection of both aqueous and oily solutions. Muscles provide a vascularized depot that permits slower absorption for oily solutions and faster absorption for aqueous ones. This makes the IM route suitable for both rapid and long-acting drug formulations. Are intravenous injections more suitable for oily solutions? False. Intravenous injections are not suitable for oily solutions. IV administration requires water-soluble drugs to avoid vascular irritation or embolism. Oily formulations are typically used in intramuscular or subcutaneous injections for depot preparations, not for intravenous use. Which statement about inhalation is incorrect? Inhalation provides slow access to the general circulation. The statement that inhalation provides slow access to systemic circulation is incorrect. Inhaled drugs are rapidly absorbed through the lungs because of the large alveolar surface area and rich capillary network, making this one of the fastest routes of administration. Inhalation is ideal for respiratory medications and emergency drugs requiring rapid onset. Are most drugs distributed homogeneously throughout the body? False. Most drugs are not distributed homogeneously throughout the body. Lipophilic drugs tend to accumulate in fatty tissues, protein-bound drugs remain in plasma, and hydrophilic drugs stay in extracellular fluid. Understanding the heterogeneous distribution of drugs is essential for predicting pharmacologic effects and calculating the volume of distribution. Which of the following is not considered a biological barrier? Renal tubules. Biological barriers prevent drugs from freely accessing certain tissues. Examples include the blood-brain barrier, the placental barrier, and the testicular barrier. Renal tubules, however, are involved in excretion and are not considered a biological barrier. Remember, barriers restrict tissue penetration, while excretion pathways remove drugs from the body. What is the reason for the complicated penetration of some drugs through the blood-brain barrier? Absence of pores in the brain capillary endothelium. Some drugs have complicated penetration through the blood-brain barrier because of the absence of pores in brain capillary endothelium. The tight junctions between endothelial cells prevent most drugs from diffusing freely into the central nervous system. Only small, lipophilic, and non-ionized drugs can cross easily, while hydrophilic or large molecules may require special transport systems to reach the brain. What does the volume of distribution, VD, relate? The volume of distribution, or VD, relates the total amount of a drug in the body to its plasma concentration. It is a theoretical parameter that helps us understand how extensively a drug distributes into tissues. Drugs with a high VD distribute widely in tissues, whereas drugs with a low VD remain mostly in plasma. VD is essential for calculating proper loading doses and predicting tissue penetration. For calculating the volume of distribution, VD, what must be taken into account? To calculate the volume of distribution, the plasma concentration of the drug must be taken into account. Plasma levels indicate the proportion of the drug that remains in circulation versus the amount that has distributed into tissues. Remember, VD is not the actual physical volume but a pharmacokinetic concept that guides dosing strategies. Is a small volume of distribution common for lipophilic substances that penetrate barriers easily? False. A small volume of distribution is not common for lipophilic drugs that penetrate barriers easily. These drugs distribute widely into plasma, interstitial, and intracellular fluids, leading to a large VD. Hydrophilic drugs, on the other hand, often remain in plasma and have a smaller volume of distribution. What does the term biotransformation include? Biotransformation includes the physiochemical and biochemical alteration of drugs in the body. The liver is the primary site, and the process involves two phases. Phase 1 reactions, such as oxidation, reduction, or hydrolysis, introduce functional groups, while Phase 2 reactions conjugate the drug with polar molecules. This transformation facilitates drug excretion and sometimes reduces pharmacologic activity. Biotransformation of drugs aims to render them less lipid-soluble. Biotransformation generally renders drugs less lipid-soluble. Converting lipophilic drugs into more hydrophilic metabolites reduces tissue accumulation, facilitates renal excretion, and can decrease the duration of pharmacologic action. This process ensures safe elimination of drugs from the body. Which drug type undergoes prominent microsomal oxidation? Lipid-soluble drugs. Microsomal oxidation is most prominent for lipid-soluble drugs. These drugs are poorly excreted unchanged, so liver microsomal enzymes, particularly cytochrome P450s, oxidize them to increase polarity and water solubility. This allows the body to eliminate lipophilic drugs efficiently. What is the effect of microsomal oxidation on drugs? Microsomal oxidation increases ionization and water solubility of a drug. By introducing polar functional groups, Phase 1 metabolism prepares lipophilic drugs for excretion. This transformation may reduce pharmacologic activity or create metabolites for further conjugation in Phase 2 metabolism. What is the effect of liver microsomal enzyme stimulation? Stimulation of liver microsomal enzymes can require a dose increase for some drugs. When enzyme activity is increased, drugs metabolized by these enzymes are cleared faster, potentially reducing therapeutic plasma concentrations. Common inducers include rifampicin, phenytoin, and phenobarbital, and dose adjustment may be necessary to maintain efficacy. What is metabolic transformation? Phase 1. Phase 1 metabolic transformation involves oxidation, reduction, or hydrolysis of substances. This process introduces polar functional groups to lipophilic drugs, making them more water-soluble and sometimes altering pharmacologic activity. Phase 1 reactions prepare drugs for Phase 2 conjugation and are primarily mediated by liver microsomal enzymes.